Hello, I'm John Amundsen, and this presentation will focus on selection tools and resources to build consumer health collections. So the question is, why consumer health in libraries? With the passage and ongoing implementation of the Affordable Care Act, as well as continuing aging of society, particularly as the baby boomer generation reaches retirement age, and as healthcare costs skyrocket, people will be turning to the library in order to find reliable information in order to make informed healthcare decisions. So, as librarians, we are experts at finding authoritative and good information, and so that should also apply to healthcare resources for consumers. So, without further ado, let's get started. So this presentation is going to take a look at several professional groups and organizations and look at any selection tools, evaluation resources, consumer information clearinghouses, or professional development opportunities that they may offer. So the groups that I'm going to be taking a look at in this presentation will include the Medical Library Association and its associated Consumer and Patient Health Information Section, or CAPHIS, the National Library of Medicine, which is a unit of the National Institutes of Health, the National Network of Libraries in Medicine, as well as the American Library Association and Reference and User Services Association. So the first organization that I'm going to take a look at is the Medical Library Association. I have their mission statement up here, and essentially the organization is geared exclusively for scientific and educational purposes and is dedicated to the support of health sciences research, education, and patient care. So the education piece as well as patient care piece is really kind of front and center with regards to its role in consumer education specifically. A couple of resources that MLA has put out includes a tool that it has developed for librarians and consumers alike to evaluate and take a look at web resources. There's a wide universe of consumer health information on the internet, and what this resource really aims to do is to have folks think critically about what they're looking at online and seeing if it's authentic or if it's flawed. And also MLA provides a consumer health information specialization, which is a continuing ed certification for those who are interested in consumer health librarianship to keep abreast of current trends and resources. So let's go over to the website. As you can see, the website for CAPHIS, I'm sorry, let's see here. We're going to start off with the Medical Library Association, the Find and Evaluate Health Information on the Web. This piece starts off with a pretty important statistic where it says 59% of U.S. adults say that they have looked online for information about a range of topics in the past year. That is a tremendous amount of people who are turning to the web for information. So what this resource does, as I've mentioned before, it kind of introduces folks to the concept of looking at these resources on the web and determining whether or not they're worth their time. So it gets you started in terms of explaining the different ways that search engines rank items, not necessarily by relevance, but by popularity or hits, which isn't necessarily always a guarantee of relevance. So what MLA has done is they've put forth some evaluation guidelines that really, in my opinion, echo prevailing thoughts in librarianship with regards to how to critically think about resources and how to evaluate them. Because point number one, who is sponsoring the website? That speaks to authenticity. That speaks to relevance. Number two, how often is the site updated? That speaks to currency, right? And steps number 3 and 4, again, kind of looking at bias as well as what the website is trying to do. Who is it trying to speak to? So this is a great resource that MLA puts out for folks to take a look at when they're looking at web resources, which constitute the vast majority of consumer health information out there. And as I had mentioned before, MLA has a consumer health information specialization, so their website also contains information with regards to levels and requirements, how to earn continuing ed credits, and all the like, as well as application instructions. And all of these resources can be found on www.mlanet.org. I will be providing a handout, of course, to this presentation, which will have links to MLA resources. So don't worry about that. So those are MLA's main resources. And MLA has over 5,000 individual and institutional members. But an important part of MLA, and I would say probably the most important group that's devoted to resources for consumer health information, is a subunit of MLA, which is the Consumer and Patient Health Information section. CAFIS assembles collection development resources as well as recommended lists of web tools, books, journal articles, and so forth. It publishes a quarterly newsletter, which, in addition to having news about the organization, also posts book reviews in the field of consumer health information, as well as a top 100 list of health websites you can trust. MLA CAFIS also has an active email list that is there, where folks who work with consumer education resources delve and discuss different reference inquiries, as well as any sort of collection development issues or new books or book reviews that are out there. And I believe that is a free listserv for folks to sign up for. And a lot of the main collection development resources on the website are member-contributed bibliographies and suggested core lists, as well as the aforementioned top 100 web list and titles in other languages. And CAFIS also produces an evaluation resources, which constitute member-contributed bibliographies, including books and articles describing current trends. So let's go over back to CAFIS's website. And CAFIS.mlanet.org is their direct line. And as you can see here, this is their website. But the first page I would like to show you is the collection development page. Now, the collection development page for CAFIS is, let's see here. It consists of, as I mentioned before, member-contributed bibliographies, and basically it focuses around core collection recommendations. It even includes a link to Library Journal's Best Books list, which I'll get to later in this presentation. But essentially these bibliographies are excellent, if somewhat aged and inconsistently formatted resources for folks developing a consumer-focused healthcare collection in their libraries. So if you take a look here, these are in a kind of a hodgepodge of formats, unfortunately. So if you click on this link here, it will take you to an actual PDF of a list of recommendations from the University of Alabama Birmingham, and this individual, let's see here, K. Hogan Smith. And as you can see here, there's not necessarily reviews or annotations with this bibliography, but these are nonetheless recommendations that she has assembled, and they're sorted by topic, and they include price as well as citations. But again, it's a good recommendation list. I think it may be better suited if there was annotations or book reviews. But as you can see here, if you click on the next link, which has another bibliography prepared by Lily Liu of the Arkansas Children's Hospital, the library there, it doesn't actually go out to an external page. It stays within the CAFIS website, and it actually is a navigable website where you can take a look at the different categories that these recommended titles have been put under. One concern that I have, that's more an overarching concern for CAFIS's collection development tools, is that a lot of them are not the most up-to-date I've seen. For example, this bibliography was originally created back in 2005, and it was updated since in 2010 and 2013, but it's now 2015. So I would keep that in mind if you ever find yourself utilizing these resources, to keep an eye out on how current these documents are. Another piece I'd like to show you is the evaluation tools and bibliographies that have been posted by CAFIS members. Again, these are simply bibliographies as well as list recommendations, including MLA publications, resources from NIH, as well as recommended books and journal articles that cover the current scholarship with regards to collection development for consumer collections, and some miscellany. That said, again, the overarching concern, as you can see here, this was updated almost 2 years ago. So that's something very important to keep in mind when you're utilizing these resources. Other CAFIS resources include the top 100 health websites you can trust, because again, the vast universe of consumer health information is on the web, and so CAFIS has assembled the top 100 websites in accordance to their criteria. They have well-stated collection guidelines, and yeah, that's disappointing. As you can see, these websites are separated by topic, so you can take a look at these various websites that deal with various areas of health. And finally, Consumer Connections, which is CAFIS's quarterly newsletter. And I would say that this is probably the more timely resource that CAFIS puts out. The last one was published back in 2014, October to December. And so it contains information about the organization, so the message from the chair, as well as conference information, but also, as you can see, there's book reviews, and you can take a look at this fairly comprehensive book review that lists everything, and since it's from late 2014, it is relatively recent, so it's a good resource. And from web resources I've seen on NIH and as well as NMLM, which I'm going to get to in a second, refer to the newsletter as a great resource for keeping on top of book reviews. So there's that. And now we shall go to the National Library of Medicine. The NLM is part of the National Institutes of Health, and it was established back in 1984. It is the world's largest medical library, and it produces two important consumer-oriented clearinghouses for information, including Medline Plus, which is curated online health information in both English and Spanish, as well as PubMed Health, which is consumer-oriented information on clinical studies and treatment of diseases. It also has, and it ranges from very consumer-oriented articles to very technical articles. So let's take a look at these resources. Medline Plus, you can take a look at various health topics. It's a very easy to navigate web page. You can click on that, and it'll show you a list of disorders, body location, demographic groups, health and wellness. This website was created in the wake of the success of WebMD, which was the National Library of Medicine's effort to make something that is more more immune to bias and more authoritative, and not as biased as a resource as WebMD, but still provides something that is comprehensive and easy to navigate. And there's video content, it's interactive tutorials, anatomy videos. It is a very comprehensive site, and it's geared towards consumers. The other site that we were discussing is PubMed Health. Again, this is a website that is meant to make information about the treatment of diseases, as well as research and clinical information on how medicine is addressing different treatments for diseases, with a variety of posted articles that range in technical specificity, from really dense medical jargony articles to easy to read and comprehend consumer information. So for example, let's take a look at Alzheimer's disease. And as you can see, in the search results, you can click on article types, and you can narrow it down to consumer information. And there you can take a look at different articles, such as medications for the treatment of Alzheimer's disease. And here you can see in very easy to comprehend language, this article conveys the importance of how this disease is treated. So it's yet another valuable resource from NLM. And we'll also take a look at the National Network of Libraries of Medicine. It's an effort that's coordinated by NLM, and it consists of libraries and health information centers from across the United States. And it has basic information on having a medical library, including collection development resources. It can be a bit basic, and the website is really, unfortunately, riddled with broken links, unfortunately. But nnlm.gov is the address, and as you can see, there's an overview of collection development resources, as well as a link to NLM's catalog of books for folks to take a look to see what NLM has. That's a good tool. The brand and selected lists link, unfortunately, is broken. And it also gives you some other options to take a look at purchasing. And unfortunately, some of these links are unfortunately broken, but it still does have some good information in there. And let's go back. So now let's go to the American Library Association and RUSA. The American Library Association's library has helpfully compiled two great issues overviews, including health information in libraries and a fact sheet specifically geared towards the Affordable Care Act. And the Reference and User Services Association, which is a division of ALA, has created a Be Well Informed at Your Library initiative. So we'll take a look at some of these resources. So health information in libraries is it's one of several fact sheets that the ALA library produces, but it provides a general overview of how libraries can provide information on medical conditions, diseases, surgeries, prescriptions, information about doctors and hospitals, and it gives a basic bibliography of books, suggested articles, as well as webinars on providing medical information in libraries. So you can see these recommended websites that can give you healthcare resources for geared towards patrons, as well as more academic library professional oriented literature to take a look at how libraries can provide information to healthcare resources for consumers. Another one of these fact sheets is the Affordable Care Act fact sheet, and essentially what this does is it outlines the basics of the 2010 Affordable Care Act as well as its implication for libraries, and it provides an overview of ALA policy statements and initiatives that are geared towards assisting libraries and providing information to the public about ACA. So as you can see, here's the overview, and it provides the foundations within ALA policy as to why libraries do this, at least within the parameters of the construct of ALA and its conceptualization of libraries and their role in society. And it provides key resources from the government, as well as outcomes from a partnership that ALA had with WebJunction IMLS, which is the Institute for Museum and Library Services, Health and Human Services, and WebJunction, which is a project of OCLC. So a couple of opportunities to sign up for more information through that initiative with regards to ACA. And then there are other government agencies that cover this information. So that's a good resource there. The Reference and User Services Association a few years back undertook a initiative called Be Well Informed at Your Library, which was geared towards working with reference librarians across the country to give them lists of recommended resources, and they did create a brief bibliography of 6 resources that are recommended reference tools. Unfortunately, these resources are a bit old now, so I am hoping that RUSA will update update this piece as reference tools are important to have. And let's see here. And last but not least, Library Journal provides a list called the Best Books issue every year, and for 2014, and consumer health is usually a part of those recommendations. And so for 2014, here are the recommended books. Unfortunately, they don't have any reviews. But that said, these are books that Library Journal, which is a well-established collection development source of information and tool for selectors, it's worth checking out. So there's that. And finally, that does it for my presentation. If you have any questions about this presentation or health information resources for consumers, please let me know. Here is my email address. Otherwise, thank you very much, and I look forward to seeing all of your presentations.